I think you come to PCI for lots of reasons, because most of the time people don't have a singular problem. Now, don't get me wrong, they might just have allergies. They might also have just sinus disease, but most of the time they have multiple symptoms. We treat allergies aggressively because we're trying to treat other things frequently, especially sinus disease. People who have sinus infections, sinus problems, if we control their allergies, then we can get rid of their sinus issues without having surgery. So we take a slightly different viewpoint than maybe anywhere else you might go for that. And people might say that we're being a little bit aggressive, but maybe we are, because we're trying to treat not just your allergies, but all these other symptoms that people have as well. You also have a tried and true tested form of treatment. Now, don't get me wrong, that treatment exists in multiple locations. But again, we go through these extra steps of trying to prove that our patients do well, not just talk about studies that you read from somewhere else. I looked at 1,000 of my own patients in a study that's not peer-reviewed or anything like that, but we just wanted to keep track of how they did, how often they needed surgery, how many times they could have had surgery but avoided it, that kind of stuff with medicines versus immunotherapy. And basically it showed that more than 85 to 90% of people are going to have dramatic improvements in their symptoms. And these are people's, answering symptom questionnaires before, during, and then after their treatment and immunotherapy. And they have dramatic improvements. But the most common statement we get from patients who are about to be finished or says, it changed my life, and essentially, I didn't realize what I was living with, kind of thing, sort of statements. And that's nice to hear, because they're on so much fewer medicine. They're not getting sick all the time. They don't go to the doctor as much, and all the things that go into that. And so you're going to get treated from that with that thought in mind. We treat a lot of patients. So experience matters. Again, we have, I don't know exactly how many, but several thousand allergy patients, whether on shots or drops or even just medicines. And so the processes are in place. It's safe, effective treatment that can really help people.